The examination of bone marrow is crucial to aid in the diagnosis and treatment of certain diseases and disorders. This is an invasive procedure, and the specimen needs to be handled very carefully to ensure proper processing. The procedure described here is the collection of bone marrow from the posterior iliac crest of the pelvis. In a small percentage of cases, bone marrow can be obtained from other sites, but those may present a higher risk of complications to the patient. The procedure is performed by physicians and other healthcare practitioners who are assisted by medical laboratory scientists or bone marrow technicians. Supplies needed include the bone marrow tray, formalin vials for specimen preservation and storage, lidocaine vials, heparin vials, alcohol preps, sterile gauze pads, glass cover slips, slides, disposable weigh boats, extra needles, forceps, assorted specimen tubes such as EDTA or SPS depending on the tests requested, notepads, a ruler, histo-wraps, and skin cleansing wipes to remove iodine from the patient's skin after the completion of the procedure. Following an explanation of the procedure, and after the patient has signed the provided consent form, the patient is directed to lie on the examination table in the prone position. The provider then locates the posterior superior iliac crest. A permanent marker or pen is used to designate where the needle will enter the patient's skin. The site is then cleansed with iodine swabs provided in the bone marrow tray. The provider dons sterile surgical gloves before handling any objects on the tray. A sterile drape provided in the tray is put around the site to create a sterile field on the patient. Additional drapes may be used if so desired by the provider to avoid body fluids coming in contact with the patient's clothing. A small area is cleansed with an alcohol wipe to remove the iodine at the entry point, and the site is anesthetized with a generous amount of lidocaine. The technologist or technician assists by holding the lidocaine vials so the physician can both see the label and can safely remove as much as needed to numb the surrounding tissue and the periosteum of the bone. The physician may need to use additional lidocaine. Some tests require an anticoagulated specimen. This is accomplished by the addition of heparin to sterile syringes prior to the collection of the specimen or pulling a syringe of bone marrow and adding it to a fresh EDTA tube. While the lidocaine is allowed to numb the area, the technologist or technician hands as many sterile syringes as needed to accommodate these requests using sterile technique. The technologist shows the label to the practitioner and holds the bottle so a needle can be inserted while maintaining the sterile field. A small incision is made in the skin with a scalpel blade, and the Illinois aspiration needle is inserted into the marrow cavity of the bone. A syringe is then attached to the needle, and a small amount of bone marrow is aspirated and deposited by the provider into a disposable weigh boat. The technologist or technician examines it for the presence of spicules and reports to the physician if they are present. If spicules are not present, an additional attempt may be necessary. While the provider is obtaining additional anticoagulated specimens needed for other tests, the technologist makes aspirate pull smears from the bone marrow specimen in the disposable weigh boat. It is important that this is done quickly, as the marrow will begin to coagulate and form a clot. This is accomplished by picking up bone marrow with spicules using a glass Pasteur pipette, placing a single drop on one 22 by 22 millimeter cover slip, and placing a second cover slip over the drop. The technologist then gently pulls them apart, creating a thin layer of cells that will later be stained for morphologic evaluation. Once the required aspirate specimens are collected, the provider will remove the smaller Illinois needle and insert the Yamashita needle to obtain a bone core biopsy. Once obtained, the core is removed from the needle and placed in a new weigh boat, visualized to ensure acceptability, measured, and the size is recorded. Touch preps are made by gently rolling the core biopsy between two glass slides, allowing cells attached to the outside of the core to deposit on the slides. The core is then placed in a vial of formalin for further processing in the histology laboratory. The provider is then given a skin cleansing wipe to remove the iodine from the skin of the patient, covers the insertion site with a bandage, and applies pressure. The aspirate smears are labeled with an approved permanent marker. Smears are blotted with paper to remove excess fat globules. The original aspirate sample is allowed to clot and is put in histowrap and placed in a clean formalin vial. Specimens and syringes are labeled with patient name, medical record number, date, time, and the technologist's identity. The area is cleaned and the specimens are sent for testing. The specimen slides are placed in their own bag and sealed, while the formalin specimens and paperwork are placed in a separate bag to avoid partial and inappropriate fixation of the slides.